This segment of CoastLife is sponsored by Beebe Healthcare.
Well, if you've been considering a career in nursing, there is no greater teacher than hands-on experience. And that is exactly what students get when they get to practice on patients, like our new friend here at the Margaret H. Rollins School of Nursing, Beebe's Nursing School. And it is such an effective program that nurses graduate feeling ready and prepared for the job ahead.
The Margaret H. Rollins School of Nursing is the only hospital-based nursing program in Delaware. It offers an accredited RN diploma program that focuses on foundational nursing excellence, experiential learning, and ongoing guidance for students as they prepare to take the nursing licensure examination, a program that builds semester to semester and year to year.
We start with basic skills. Students may start out on small little injection pads. Okay, so there's different types of fidelity with simulation. So there's low fidelity, and that basically is just like a practice skill task that they're learning. So they learn in the classroom about how to give, say, an injection, and then we give them in the simulation lab an injection pad, fake medications, where they're actually able to pull up a medication and then use a little pad. So those are like basic low fidelity. We move from that type of low fidelity to maybe when they're learning to start an IV, they'll start on an IV pad. And then once they learn how to start in a little square pad, they will then move to an IV arm that actually has blood return in the IV arm before they're then moved to a mannequin. And then mid-fidelity would be our other simulation lab, where we have mannequins that they have lung sounds and breath sounds, and they learn to do like a head-to-toe assessment. And then the high fidelity is the simulation scenario where there's a whole story behind a whole patient, where they're interacting with, they're communicating with, they're taking what they've learned in the classroom, their skills that they learned, and they're bringing it into this scenario to perform everything together, kind of putting it all together in one place.
And that's all just year one.
We start out second year in special populations groups, so that is specific to mother-baby, labor and delivery, emergency room nursing, and pediatrics. And what we try to do is give them some scenarios that maybe they may not see in their clinicals while they're here, give them those experiences here. So they'll actually be in a delivery for a mother who's having a baby.
Students also work their way through a number of pediatric scenarios. All the simulations are designed to help students get used to the very real situations that they may be placed in when they're in a hospital setting.
So I take where they are in the classroom and what content that they are studying, and we try to align our simulations with that content to, one, reinforce the content they're receiving in the classroom, and to also prepare them for the clinical setting as well, to care for a patient with such diagnosis. An example would be heart failure. So I take a look at that, and then I create a scenario based on well-established scenarios out there through organizations such as National League of Nursing, and then tailor to some degree according to what I want them to achieve in the simulation. We have a retired faculty member who comes in and plays the role as a family member, so that also enhances the experience and makes it very realistic to what they encounter in the hospital setting.
One of the most unique ways the students train is through a control room, where Teresa and Katie can watch students in the simulation and react to decisions that the students make.
We're watching them. We can zoom in from these cameras above to really see that they're performing the skills correctly. And also we can go back and watch their scenarios just to clarify anything. We can mark in real time a medication administration that we need to clarify. Additionally, we've also used some of the videos as self-reflection and team reflection for the students who work together as a group, that they can watch their scenario and evaluate themselves and their team dynamic.
And then back in that control room is where I sit, and as I'm controlling the mannequin, so I'm controlling the vital signs. So if a student, if her oxygen level was low and the student goes over and increases the patient's oxygen, then behind the scenes on the computer that's controlling her, I will then, as positive reinforcement, you did the right thing, so now I'm going to increase her oxygen saturation for them.
And best of all, the simulation lab allows students a safe place to learn from their mistakes without patient harm.
So they're learning from their mistakes so that when they go into clinical, they actually are providing safe patient care before they even become a professional nurse.
And we can collaboratively discuss at the end of scenarios, their reflection on how the scenario went. Did they identify anything that was a mistake, and really for the greater good of all of the students who participated in it?
Of course, as the students move on into the real world, Beebe School of Nursing is proud to share them.
I think as a faculty member, one of the most rewarding aspects is seeing, for example, right now we're in that first year, second semester, the progression to next year when I have them again in 201, which is the first semester, the fall year, to see the growth of the students. It fulfills a lot of pride, I know for me, and it also fulfills a lot of pride for the students too.
When we do things in the simulation lab, then can go to the hospital and they can create the same environment and safety and things. And one specific is last semester, students learned about hemorrhage, postpartum hemorrhage, and before they went over to the hospital and when they were in mother-baby, there was an actual patient that was hemorrhaging. The students recognized that and were able to put hands on and help and be of help to the staff there. So that makes me, as the simulation coordinator, and a labor and delivery nurse by background, very proud that I was able to give them that experience here in the lab.
And of course, none of what this incredible program is able to do would be possible without the community's support.
We're very thankful for the Beebe Medical Foundation and all of the support for all of the mannequins that we get here. We're actually getting some new mannequins, newer, better mannequins that can really function more and give better simulations to the students, and also the community supporters and community donors that we have here. We're very fortunate here.
Well, if you would like to apply to Beebe's nursing program and check out their School of Nursing, make sure you contact them and figure out how you can apply. But there's more CoastLife coming your way that you're not going to want to miss.